As a pediatrician, I'm looking for clues to your baby's health. One of those clues is your baby's growth chart. It tells me how your baby's growing and also how they compare to other babies at the same age. But what if your baby is growing too fast? This is the case of the Too Chubby Cheeks.
I know my baby is eating too much, but I only feed her when she cries, and she is fussy if I try to feed her less.
The problem is common. It makes a difference whether your baby is bottle-fed or breastfed or both. And the issue also changes when we start solid foods at about 6 months old. We sometimes see changes in appetite, and it can be tempting to feed the baby too much.
When the baby cries, I feed her. If I don't, she keeps crying.
A baby's main way to communicate is by crying. She may cry because she's hungry or wet or just wants to be held. By 2 months old, most babies will actually have different cries for different needs. They may be hard to tell apart, but if you listen closely, you may be able to tell if your baby is crying because of hunger or something completely different. Other signs that baby may be hungry include clenching their fists and smacking their lips, putting their hands in their mouth, or turning their head toward anything that touches their face and opening their mouth. If you're not seeing any of these other signs, perhaps it's not hunger that's making your baby cry.
When I feed her, she's just a little pig. She eats everything I give her and cries for more.
Babies will oftentimes take food when they're crying, whether or not that's really what they need. If your baby's eating too much at a time, it may actually be that she's just eating too fast. Babies, sort of like grown-ups, don't really know when their tummy is full. That message takes a little time to get to the brain, but they do know how long it takes them to eat. You can try a different bottle or a nipple with a slower flow. You can also try simply stopping the feeding a few times to play with your baby or burp her or bounce her. This trick works with breast and bottle-fed babies.
Maybe it's the formula.
Trust me, it's not the formula. It's nothing in a breastfeeding mom's diet, and adding other things like cereal to the bottle might actually make the problem worse, especially if baby's not ready for cereal in their diet yet. Try the tips that I've mentioned in this video, particularly slowing down your baby's feeding, and see if that helps. But be sure to ask your healthcare provider for individualized tricks to try for your baby. Parents, you got this. See you soon. Please hit that little thumbs up to like this video, subscribe to our channel, and then hit the little bell so that you won't miss a thing.